So let's talk about a JAMSS protocol. We're going to start with what is JAMSS. It stands for Jaw, Joint, and Muscle Sprain and Strain. And JAMSS can happen for a patient as a follow-up to a dental appointment. It can happen just as a routine experience of something that happened outside the dental office in their life. And it can show up as joint symptoms, muscle symptoms. It can be acute or it can be chronic. So when we think about JAMSS, one of the great things is that we now have a protocol for it. It really is revolutionary in dentistry today, that we actually have an easy to follow, systematic way to not only assess the risk that a patient presents and that a procedure presents for that person developing JAMSS, as well as using that same system to evaluate a patient who's having symptoms, figure out what's going on, and very quickly and effectively treat that patient so that we can have that be a short-term issue and not develop into a more long-term chronic TMD issue for that patient. So when we think about JAMSS, there's a bunch of steps to this I want to talk about, and we're going to divide them up. We're going to start with sort of defining why it's important to your practice. We're going to talk about instituting the protocol and the simple steps that you can do in your office with your team, and we're also going to give you the information you need to do that patient assessment and the patient follow-up, and then to effectively be able to manage risk and treat if a patient shows up in your practice with a post-op issue. So let's move from this video to the rest of the videos as we go through those topics. Let's talk about why JAMSS is important. And there's really several perspectives. So we can talk about why it's important from a patient perspective. We can talk about why it's important from a practice perspective. So I want to first think about it from a patient perspective. I think all of us would agree that our goal is to have our patients have a predictable level of health and function around their oral environment through their entire lives. And really, when we think about our jaw joint specifically, it's one of the few joints in our body that really doesn't ever get any rest, because we're either talking or we're swallowing or we're eating or we're singing or we're doing something, and that doesn't even include people who parafunction. So this is a part of our bodies, our physiologies, that's under use all the time. And when we do start to develop some sprain or strain, and we actually like those words specifically because patients know what those are. Really easy for patients to relate to something that would happen to an ankle or a finger, and they're already doing the same home care therapies when they experience those symptoms. So I love that that semantics works to help them understand what's going on. They automatically start to develop habits, just like when you have a sprained ankle, that can lead to different functional patterns and then set them up for even bigger problems down the road. So being able to assess this and find the risk factors on the front end to prevent that cycle from beginning can be really important for our patients so they have a lifetime full of health and comfort and function. When we think about why JAMSS is important in our practice, I can think about it from several perspectives. When I have a patient in my practice and they have a problem post-operatively, they come in for a routine dental visit, whether that be a hygiene visit or it's actually to have some restorative dentistry or potentially even a longer visit. And when they leave, they have post-op discomfort that they were not helped to understand might happen, that they don't know how to manage, that can often drive them to being uncomfortable for days or even lead into a more significant issue. That really sets us up for not being successful. They think poorly about our office. It reflects poorly on just the experience of having dentistry done. it can now set that patient up to be that much more anxious, fearful, and reticent to have future dental appointments because they don't want to have that happen again, and so they're going to be less likely to manage and maintain their oral health. So we really want to set our patients up for a successful relationship with dentistry, and we really want to be the advocate for their health and thinking about them not having those post-operative issues. So that's another reason that it's very important. The last piece that I want to touch on has to go with what we know from science and surveys. And all of us have patients in our practices who have chronic long-term issues with TMD. And we can understand and know how difficult that is for the patient, how it affects the quantity of their happy times, their being pain-free, the quality of their lives. It also can be very difficult to treat and to help that person get past that. And what we know is a large number of patients report that those chronic episodes of TMD actually were triggered by an acute incident that followed a dental appointment. And that can be one of those main triggers. And so we want to make sure that we're going to find those patients at risk, we're going to think about our procedures at risk, and that we want to take that opportunity to make the best experience for our patients with the least post-operative risks. So JAMSS is easy to implement, and it's an effective way to help our patients stay healthy, pain-free, and functional. Who needs to understand JAMSS? The easy answer would be to say everyone, but let's take it back down to our dental offices. I think we think about that as a relationship. Patients' understanding about JAMSS and knowing what it is really important because they're going to help self-assess and find a lot of the information for us ahead of time and can alert us to their risk factors. So we want to include it in our patient information. I think every member of the dental team needs to understand what JAMSS is and how to look for those risk assessments. So it could be the person who answers the telephone in your dental office, and they can listen for things the patients are saying that says this person has a risk of JAMSS. To the hygienist who might be doing your new patient interviews, they might be talking to the patient at a recall visit and can include some of this risk assessment when they do medical history update and dental history update. I think the chairside assistant needs to understand because often patients share information with them when the dentist isn't in the room that becomes vital to helping that patient and picking out these risk factors. From a standpoint of the dentist in the dental office, whether you're a general practice, you're a specialty office, whatever your level of training is, whatever your experience is and your involvement in your office is with treating TMD patients versus it's just a general practice and we refer those out, everyone needs to understand and know what JAMSS is because part of this process is picking up very early on before a problem happens for the patient that they have risk factors so that we can now be the advocate for the patient and say we're concerned that you could have some problems based on the procedures that we're doing. Let's prevent it instead of having to get it at the back end and manage it. But if we do have to manage, the JAMSS protocol sets us up for an easy, effective way to do that as well. So the easy answer to who needs to understand JAMSS is everyone in the dental profession. Let's spend a few minutes now talking about what do we do when a patient does develop signs and symptoms of JAMSS, joint and muscle sprain and strain. And we shorthand that process by using the term MEAT, which stands for movement, exercise, analgesia, and treatment. And we're going to go through those pieces, but one of the great pieces that we can share with you is a take-home or a post-op set of instructions that are printed that you can actually give your patient. And so when we think about MEAT, part of this is to give the patient the ability at home to really proactively treat themselves and help themselves get better, as well as to change their habits, change their behaviors, actually change the way that they're using their jaw to decrease the incidence of having future problems. The treatment part of this is what we're going to help them with around appliance therapy, be that interim appliance therapy in the form of a QuickSplint or longer term appliance therapy, moving them to something that's a full archer appliance or some sort of a more formal appliance therapy. So let's go back and just kind of break these down. So when we think about movement, there's really two pieces of this. One is helping the patient think about the movement or the mobility, what they're doing with their jaw, having them become more cognizant of that behavior pattern. So we want to have them focus in on that and really think about the times that they are clenching or they have their teeth together. We want to create an awareness pattern. We also think about movement from a standpoint of making sure that they know we don't want them to restrict the movement of their jaw. We need to keep things moving. We need to keep the fluid flowing in the jaw joint. But we also need them to protect that joint, just like they would protect an ankle that they twisted or another body part that was damaged. So we want them not eating really hard foods. A great example is like a bagel. So we're going to give them some ideas of foods to stay away with. We want them on a soft diet. We want them continuing to move, but being judicious about it. So that's really the M part. Now the E part stands for exercise. And what we're going to do is we're going to give them some specific exercises to do. We're going to ask them to do those frequently throughout the day. And that's designed again as twofold: breaking a behavior pattern. They're getting their teeth apart, they're actually moving things around, but they're also now stretching and strengthening and helping the musculature, keeping the fluid moving in the jaw joint. The A of MEAT, which stands for analgesia, is really several pieces. One could be using anti-inflammatories. So recommending to the patient that they take some over-the-counter or prescription anti-inflammatory medications. That could be something like Advil or Aleve or generic ibuprofen. You could write them a prescription for something in that same NSAIDs, nonsteroidal anti-inflammatory category of medications. It could also be the use of ice packs and warm, moist heat. So we're going to give them those things to do at home to not only help themselves feel better, but also to manage the inflammation. And the last piece of the puzzle, which is T for treatment, again has two phases. My very quick, easy to fabricate treatment is to make the patient a QuickSplint. So we're going to make them a QuickSplint. It's an anterior only device. It's designed to separate their back teeth. Why? Because it breaks the communication between the teeth and the elevator muscles. It reduces the activity of those elevator muscles. Therefore, the muscles are being used less. The muscles get to relax. They're loading the joint less, so the joint itself has an opportunity to heal. And then we can also think about the fact that we could transition that patient moving forward into a long-term appliance. When we think about that and whether these folks would benefit from a long-term appliance, the fact that they were already in a moderate to high-risk category for developing JAMSS, and then they did develop JAMSS, I think about appliance therapy as a management strategy because we don't want our patients to have recurrent episodes of JAMSS. We know that any time this happens, their risk of developing a more significant, more chronic problem goes up. And this is the opportunity now to put an easy management strategy in place. So what should we expect when we follow this protocol? We really expect that about 60% of our patients are going to get better in a 4-week time frame. My personal preference is to recall these patients or bring these patients back for a reevaluation. I want to make sure that I know that I've been looped in, that yes, all of this worked and they're actually feeling better. That's also my follow-up appointment opportunity to say to them, now that we're better, let's talk about what we do moving forward. Let's talk about how we prevent this again in the future. I also want to make sure that the patient knows that they've now been enabled to help themselves. They have the tools in their toolbox to help themselves feel better. And that if any of this doesn't work the way we expect it to, I'm going to invite them to pick up a phone and call me. And then we can loop back around and ask what's going on. So when we think about how are we going to move forward and treat somebody who's already developed JAMSS, we think about our MEAT protocol and giving the patient things to do at home and complementing that with things that we're going to do in our office around treatment. I'm going to have you open for me, Jenna, is when we think about the QuickSplint, you can see that it's just a little prefabricated shell. It actually has 2 little holes in it that help us with retention of the material that we're going to use to custom fit it. It also has another slit in the anterior right at the midline, again designed so that we can get retention of the material. And what I want to do first is I'm going to just try it in. I'm trying it in for 2 reasons. Number 1, I want Jenna to get to experience having it in her mouth and then actually biting against it, so that when we do that already with the bite registration material in it, she's familiar with what I'm going to ask her to do. I'm also just visually getting a reference for positioning it over her teeth. I actually do want this little slit at her midline. I also want to make sure this anterior flange of my QuickSplint is as close to the labial of her upper teeth as I can get it without it actually touching her teeth. I actually do need some of the bite registration material on that labial, so I'm getting a sense of how I can position it. And then the last thing for me is when I ask Jenna to bite, so she's practicing what I'm going to ask her to do. I'm also seeing how do her lower teeth come in contact with the QuickSplint. What I'd ultimately like to make sure is that we don't have back teeth touching, and that I'm going to get even contacts both on the right side and the left side once the material is set. So now that we've tried this in, Jenna, I'm actually going to put a material in here that is the same stuff that we use when we take impressions of your mouth to get models of your teeth. It's a little bit gooey when I first put it in. It doesn't have a bad taste. And then I'm going to put this over your teeth. I'm going to ask you again to sort of gently bite together for me, and then we're going to hold that. This material actually sets relatively quickly, but we're going to leave it on your teeth until it gets to a hard set. Okay?
Okay.
All right. So your QuickSplints, you can reline with bite registration material or other types of silicone putty. Today we're actually just going to use the bite registration material. So what I'm going to do is I'm actually going to just fill the QuickSplint shell with the bite registration material. I do want to fill it. I actually like this material to go kind of right up to the top of the white part of the QuickSplint, but I don't want to overfill it. I'm going to have Jenna open for me again. I'm lining this up with the midline, positioning the anterior of the flange, and then I'm going to ask Jenna to gently close for me. And again, I'm eyeballing and making sure that I've got a contact on both sides, but that her back teeth are not touching. And now we simply just have to hold it in place until the material sets. So now that our bite registration material has set completely, I'm going to just ask Jenna to open her teeth for me. And once she opens, I can just pop this off of her upper teeth, and I've got a relined QuickSplint. If Jenna has material between her teeth, we can go ahead and floss her teeth and we can get that out for her. And the next thing for me is I'm going to trim off the excess material on the QuickSplint. I don't want to carve it out of the areas that are designed for retention, but I do want to trim this material back so that when Jenna moves her bottom teeth around, she goes into her excursives, she's not actually getting stuck on the bite registration. It's not creating any rough spots for her to guide over. And we simply do that with a disposable barb parker or a blade. And then we're going to come back and we're just going to give this to Jenna with some quick instructions. So I'm just trimming off the excess that's on the lingual of the QuickSplint. I'm not shortening it, but I'm making sure that it's flush with the white plastic so that it's not an irritant to Jenna's tongue. Why am I not shortening it? Because it's going to actually help me with retention. I also then trim it flush on the distal, using the platform again as a guide, using the QuickSplint as the guide for where I want to trim my bite registration. In this anterior, in the midline, I want to make sure that this is trimmed flush, but I don't want to dig it out because it's going to help hold the bite registration. For me, I actually typically just will either use my finger or the blade to sort of make sure that it's nice and smooth. And the same thing on the anterior. If we have material that's gone out over the labial of the QuickSplint, we can trim that as well so that Jenna's upper lip isn't being caught on that. And we're going to try to make it as comfortable as possible. Once we have it trimmed, I'm going to take it back in and I'm going to try it in. And I'm going to make sure that I've got enough retention. And I actually like the fact that when I put it in, I can just feel a tiny little snap where bite registration is locking in a little bit over Jenna's teeth. And I can just have her bite again for me, and I can verify that I do have contact on both of her canine cusp tips, but none of her back teeth are touching. And quick and simple, we've fabricated a QuickSplint so that Jenna can have that during her procedure if I want her to rest on it. She can have that to take home after her procedure as part of her home care protocol. And if Jenna was already post-op and experiencing some symptoms, we could actually use this as a therapeutic device to help her get better and get past that as quickly and efficiently as possible. So what do we do if our QuickSplint doesn't work, or better said, doesn't work the way we expect it to work? And one of the great things about a QuickSplint is it's going to accomplish our goals of relaxing the muscles, unloading the joints, and helping our patients prevent JAMS or manage the symptoms of JAMS a large majority of the time. And when it doesn't do that, that's actually really valuable information. So that tells us a lot about what's going on for this person, about their ability to parafunction enough and apply enough force that they can actually overcome the beneficial properties of a QuickSplint. Or that what's going on for them maybe isn't as simple as something going on with their joints and muscles or an occluso-muscle relationship. So I really want to make sure that we set this up so that all of you in the dental office know, but you can also share with your patients that we've learned something very valuable at a diagnostic level if the patient's response to a QuickSplint isn't that, oh my gosh, I feel so much better, everything has gone away, and I can open wider, and we love to hear those things. And the reality is when we hear the reverse, it's valuable information. So whether you're going to now treat that patient in your practice and you're actually going to continue your diagnostics around what's going on for this patient, whether that be TMD or a different type of an orofacial pain problem, or you're going to refer that patient to somebody else now who can pick up that treatment, sharing that diagnostic information that we did make a QuickSplint. This is what the patient was experiencing before we did it. And this was the patient's response, or this is what they experienced with the QuickSplint. We've now actually shortcutted that diagnostic process for that next patient. That's valuable, important diagnostic information. And I actually will share that with my patients when I make them. I actually will tell my patients, one of three things is going to happen with this little device. You're either going to feel better, and that's awesome, and we love that, and that's important information for both of us. Or potentially, you may feel exactly the same. And that's awesome because we've gathered some really valuable information. And there's a chance that you may actually feel worse. And I know it doesn't sound awesome, but it's awesome because we've actually learned something very important about how we're going to move forward with your diagnosis and your treatment. I want to send you home today with some instructions of things that you can do to go ahead and keep your joints and your muscles comfortable after your procedure today. And one of those, of course, is your QuickSplint that we just made together. And I did promise you that everything was going to get written down for you, so I'm going to give you these pieces of paper. So one of those is it's just some instructions for actually wearing your QuickSplint. So for this very first week after your appointment, what I'd like you to do is go ahead and wear that every night when you sleep, all night long, but I also want you to wear it during the daytime. So you're going to take it out to eat, and if you need to take it out, to talk or to do something social, feel free to do that, but try to keep it in as much as possible, okay? I'm actually going to get to see you at the end of this week. I'd like to have a 1 week appointment where we have that as a post-op, and you and I can get back together so I can evaluate how you're doing. But in the second week, we're going to have you transition to just wearing that at night, so you're not going to wear it during the daytime anymore, okay? And if you'll do me the kindness of bringing your QuickSplint with you when you come back for your follow-up appointment, okay? So that's kind of one piece of that. I'm also going to give you these instructions, and there's some exercises that you can do. What we want to really make sure is that we keep these muscles moving. It'll actually really help to increase the comfort of those muscles as well as how wide you can open. Help a little with being able to help in your mouth as wide as you want to eat anything you want and to talk. And they're really simple to do. Okay, so I'm going to give you that as well. And I'm going to give you this last piece of paper to take home with you. And you actually know a lot of these things. You're actually doing a lot of these things already. You've figured out on your own. One of those would be to use medications that are anti-inflammatory, like Advil, which you're using over the counter. You can also substitute for other over-the-counter brands, but you do want to make sure that they're anti-inflammatory, okay? And so particularly in the Advils, the Aleve, the ibuprofens, the Tylenol type of medications aren't going to do this, okay? We're going to give you some instructions where you can actually alternate applying some moist heat as well as some cold packs, okay? And that can be really good as it integrates with your little exercises that we just gave you. I actually would say, even though you told me that you don't really think you have more trouble chewing certain foods, that foods that are really hard and sticky or very tough to chew actually are kind of overworking both your joints and your muscles. So we're going to ask that you actually try to avoid to eat things. So like a classic example of that might be a bagel or a really tough steak or things like that require a lot of effort to chew. So I'm going to ask you to be kind of conscious of that for this little bit after our appointment today, okay? And then there's a lot of really good additional things that you can look at. You know, with grinding and clenching your teeth, oftentimes that happens and you're not even aware that it happens. But if you do catch yourself doing that, it's great to sort of go, okay, open your teeth. I will actually tell you that one of the things I have my patients do is actually try to set like a 10 or 15 minute reminder. Lots of ways to do that. You can buy a dollar store kitchen timer. You can set it on your iPhone or whatever type of device you have. You know, I can do it where I set it on my device I wear on my wrist. I notice you have one also, right? So some way to remind yourself about every 10 to 15 minutes to just check in and say, where are my teeth? And if your teeth are together, just pop them open again. Part of why that's important is, believe it or not, after a couple of days, you'll actually catch yourself when you're clenching your teeth, where before you might not have. It might have been a more subconscious habit. So it's good kind of feedback management training to decrease the amount of time that your teeth are together. And especially during times that you know that you might have your teeth together. You mentioned studying earlier when we were talking. I know that you had told me that you do a lot of exercising. You might actually clench your teeth when you're exercising or running. So those are all good times to have your QuickSplint in and to be thinking about that. You know, I know that getting a good night's sleep is important to you, avoiding caffeinated beverages. So I'm going to send this home with you so you can sort of read through this. And the more of these things that you can incorporate, the better things will be. Okay? Okay. So what questions do you have about any of this today?
I think that covered it.
Awesome. So what I'm going to do is, on your way out, we're going to have Donna help get you an appointment in about a week, and we'll do your follow-up visit, and we'll check back in and see how you're doing.